Hi everyone, this is my first live stream. I'm going to talk about what's happening where I live in London, which has been under major restrictions for coronavirus, and what's happening around the world. You're welcome to leave comments and chat. Let's get the conversation going. Well, as you might know, London has been put on COVID high alert, what's actually called Tier 3 level. Well, actually last night people piled out of pubs onto the streets, and crowds ahead of the no household mixing indoors ban, which comes with a new high alert level, and the police had to disperse them. I don't know if you've seen the photographs in newspapers, but certainly in the UK there were lots of photos, and I guess there might have been some photos around the world as well. I live in London and I really do understand the frustration that people are facing with their lives being turned upside down by the restrictions. But hey, we're in a pandemic and I guess it's time to bite the bullet. The world hit 40 million confirmed coronavirus cases today, and as everything goes up, the virus soars to new peaks. I guess it's time to muck in and do our bit as much as we can and go back to basically what we were doing, or part of it, in the first wave. But I think this wave is going to be a bit better in the UK in the sense that we're not going to be completely locked down as we were in the first wave. However, who knows? Anything could happen. Everything at the moment seems to be unprecedented, and the virus seems to be making records every day. Over the last 24 hours, it's soared 400,000 cases of coronavirus, and that's really the highest number ever recorded in a single day. And it's kind of moved to another more deadly level. To put it into perspective, it took 3 months, I'm just looking at my notes here, to reach 400,000 cases at the start of the pandemic, and now we're hitting around that number every single day, which is just crazy. Countries also make no secret of the fact that the number of reported cases are just a sample based on the amount of testing carried out, with the true number of cases maybe 10 to 85 times higher according to the World Health Organization, depending on the actual country, because there's shortages of tests, limited funds and overstretched health systems, which can make it all difficult to carry out widespread testing. My mask is slipping, sorry. Anyway, the UK this week reported 20,000 cases on one single day, and France has reported over 30,000 cases in 24 hours. And Spain's also reporting a big surge in infections, although autumn hasn't even started yet. We haven't moved into winter. And worryingly, the number of people in hospital is accelerating in Europe, with a number of cities reporting they expect to reach their intensive care bed capacity in the coming weeks. So, before I tell you more about the battle going on where I live, let's take a quick look at the countries and regions on the COVID watch list right now. That's a World Health Alert Crisis watch list. On watch! The picture in Europe looks bleak, I'm afraid, while the United States and Canada are likely to be pulled further into the roller coaster as the whole of the Northern Hemisphere moves into winter. These are the cities and countries on the watch list right now. They're London, Paris, Madrid, Berlin, Zurich, Denmark, Netherlands, Poland, Italy, Germany, Belgium, Russia, Czech Republic, Netherlands, Switzerland, Austria, Sweden, and that's just some of the places in the early stages of the second wave. In the Americas, on the watch list are New York, Seattle, Chicago, Winnipeg, Montreal and Anchorage. Elsewhere, India, Brazil, Mexico and Argentina are still not out of the woods, while Morocco and Addis Ababa have been put on the watch list. On the other side of the globe, China, South Korea, Japan and Wellington are on watch. So keep watching for details about the battle brewing. The United Kingdom, you may have heard, is fighting a battle on all fronts at the moment, unfortunately. Not only has the second wave, this mask is a bit big for me. Sorry, I'm putting it into the wrong, yeah, that's better. Not only has the second wave of coronavirus begun to hit, but the battle between the Prime Minister, Boris Johnson in the UK, and his scientists over the new 3-tier COVID system has kind of reached fever pitch. The scientists are saying the UK needs to go into what's called a circuit breaker lockdown now. That's a short lockdown, but Boris isn't having it, at least not for the moment. Maybe he'll change his mind next week, I don't know. On another front, Greater Manchester's mayor is refusing to move his area up to the highest COVID alert level 3 unless the government hand out more dosh. The problem is, if the government agree to extra funding for one city or region, they're going to have to do the same for other regions, and there really isn't enough in the coffers to bail out everyone. I guess they'll have to come to an agreement, so otherwise Boris has said he'll enforce it anyway, and that could be a nightmare. Meanwhile, the virus is turning into a monster. We've got to hit it on the head. The government needs to take massive action right now, yet it's still kind of tinkering around the edges, but it feels like Boris has something up his sleeve. Going for herd immunity by default will be a tragedy, as studies have shown that people can get reinfected with the virus. And the Health Minister in the UK, Matt Hancock, pointed out earlier this week that many infectious diseases never actually reach herd immunity, like malaria, measles and flu. And there's no reason to think that coronavirus would be any different. If Boris put the whole of the UK on the top 3 alert, or he went for a full circuit lockdown for 4 weeks, I wonder what you think. Would that be enough, or should he do even more? My view is that all major cities need to go on a higher level, a tier 4 alert, and the UK and Europe needs to get on with it. There really is no time to lose. Whether the action they take is a circuit breaker lockdown, a tier 3 or a 4-tier shutdown or something else is immaterial, really. All that matters is that the governments get on with it. We haven't got time to waste. Basically, the virus is programmed to divide and rule. Don't fall for it. Let's find our fighting spirit. Go for the hero inside of each one of us. People are fed up and shocked, overwhelmed and angry. That's understandable, but that doesn't change the fact that the virus is still among us. It's kind of war. It's a war with an invisible enemy, like no other really that we've seen. And in most wars, the thing is that you can see the enemy. So anger is directed at the enemy, but you can't negotiate with COVID. It hasn't got a brain. Its sole purpose really is to multiply and infect. An idea. Get out a pillow, draw Corona on it and start boxing. I set up a hashtag, COVID boxing on Twitter if you want to join it. Vent your fury on Corona. Declare war on it. Do whatever it takes to stamp it out with physical distancing, hand hygiene, masks, respiratory etiquette, ventilation and avoiding crowded places to buy time to slow down this infection. Get everyone attacking the virus, not each other. If you actually look at the raw data, it's worrying. The UK needs to follow what the data's telling them and take action now. today, not tomorrow, not next week, now. Our power, I believe, is vested in each and every individual in the country. The best way to mitigate this natural disaster is for all of us to play their part. And the government can't change the fact there's a pandemic. It doesn't have a magic wand, but it can make it easier to bear. For example, the government could give everyone on universal credit £500, a one-off for COVID preparation that could create the Rishi Sunak feel-good factor and spur the masses to jump on board. The public need a morale booster. Let's face it, the UK, Europe and much of the world is in the middle of a pandemic that's intensifying in many places. Our routines have been thrown out of the window. Life as we know it is now fluid because restrictions are lifted and slapped on with a day or two's notice. The problem is we're in a pandemic and pandemics can threaten people's lives, and I don't want to just now. I'd like to get through all of this and come out the other side. Problem is there seems to be an element of anarchy creeping into society, with some people taking coronavirus with a pinch of salt, ignoring the rules because they believe there's very little chance of them getting it, and they just don't. They just want to get on with their lives. They're fed up with coronavirus, and somehow leaders need to reach out to them and empower them to follow the rules so we can fight this virus together. Let's take a quick look at some key data. Tell me what you think. The official Public Health England data shows that COVID-19 cases have rocketed in 10 to 19-year-olds since schools reopened in September, from 10 in 100,000 to 240 in 100,000 by the beginning of October. PHE data underlines that 10 to 19-year-olds have the highest number of positive COVID tests since the start of September. 2,500 positives in 1 week at the end of September. That is despite the fact that tests are rarely made available to school children, which causes the plight of children to just disappear from the data. Children have no right of reply, they've got no unions, and their parents, the majority who are not wealthy and powerful, are threatened with fines if they don't send their kids to school because they're worried about the risk of COVID in countries that have a high infection rate. Basically, schools are riddled with COVID. There is not one school that I know parents who have children at in the area that don't have cases of it. And children, in particular teenagers from age 10 upwards, are falling ill. And a huge number of schools all over the country are reporting cases. The problem is most of them haven't been tested because tests weren't made available for them. Children and young people have also been led to believe they're invincible to coronavirus, but that's not entirely true. Children do get COVID, and many of the cases are mild, it's true, but some do end up in intensive care, and for some it is fatal. It's particularly hard for children who have underlying conditions. Children are really being subjected to herd immunity by default rather than being protected, while adults who have unions and have a way of standing up for themselves are being allowed to work from home, as are many university students now. If you have any thoughts on this, please let me know. Let's move on. Let's go back to what Boris, the UK Prime Minister, is going to do about Greater Manchester, which is in northern England, because the mayor there has refused to go onto Tier 3, the high alert level, unless he gets a lot more money for the area. The problem is, if the government agree to the funding, as I said earlier, for one city, they're going to have to do it for other cities. And my worry is that the UK just doesn't have enough money to pay out to everyone in all these different areas. But I'm hoping, and I think they'll come to an agreement with Manchester through negotiation. They really do need to do that because Manchester's figures in terms of coronavirus are sky high, and they need to protect their population. The UK, I think, is going through a massive transformation, and the government, actually most countries in the world, let's add that, and the government is doing its best to create a soft landing. A national lockdown is simply a number of local lockdowns. The numbers are going up quickly in the UK and in other parts of the world at the moment, and winter hasn't even started yet. I think the 3 tiers in the UK system is a base, and government could use it very quickly to step up the restrictions if they need to, or well, I do think they need to do it now. And when we get the characteristic explosive stage of COVID, which really hasn't happened in earnest yet, I think the country will go into lockdown because there'll be no alternative. The government seems to be treading softly because people are just fed up with all of this. They don't want to be in lockdown. Right now, what needs to be done is that all the tools in the toolbox need to be used. Every single one of them. You know, the COVID tools are case finding, isolating, testing, caring, quarantining, physical distancing, hand hygiene, masks, respiratory etiquette, ventilation, avoiding crowds, and at some point there's no choice but to issue other measures to buy time to slow down infection, and the UK is there. The Liverpool region in northern England was the first to go on the very high alert tier 3 level. That was earlier this week on Wednesday, and then Lancashire followed today. It went into the high alert, very high alert level with what's called tier 3 rules at 1 minute past midnight today. And if a national lockdown is announced soon, then if a national lockdown is not announced, soon, then the following cities could be next into the very high alert level because infections are spreading fast. That's Manchester, either voluntarily or by force, if a deal isn't struck with the government. The Prime Minister said he'll do it anyway because he feels it's his duty. Then there's Bradford, that's likely, Leicester, Nottingham, Bury, Salford, Sheffield, Newcastle, Sunderland, Leeds, Hartlepool, Gateshead, Rotherham, Barnsley, Durham and Birmingham. Then there's the tier 2 level, which is a high alert, rather than the very high alert. And apart from London, other cities and regions on that are Essex, Elmbridge, Barrow, Inverness, York, North East Derbyshire, Chesterfield, Erewash, Warrington, Tees Valley, South Yorkshire, Nottingham, North East Leicester, Greater Manchester, Derbyshire and Cheshire are all in the higher tier 2 level. Again, if a national lockdown is not announced soon, then the next areas to join tier 2 could be Exeter, Luton, Oxford, Watford, Hertfordshire, Slough, Staffordshire, Lincolnshire, Warwickshire, Rugby, Hurstby, Dartford, Croydon, Newham, Surrey, Heath, Sutton, Reigate and Banstead, Sutton, Waltham Forest, Reading and Epping Forest, as infections are rising in all those places. Yeah. For now, it's about learning to live with uncertainty. Until the UK and the rest of the world rides out this storm, there's also a conflict in the world which we need to keep our eye on, as it has the potential to widen. The war in Nagorno-Karabakh in the Balkans is an area both Armenia and Azerbaijan lay claim to. You've got to remember that Azerbaijan supplies oil and gas to world markets, in particular Europe, and the conflict is very close to Azerbaijan's main oil pipeline, and main gas pipeline to the world, which increases the risk of damage to the pipeline. So basically, let's go back and return to coronavirus. There is hope on the horizon. A COVID-19 breath test that's been developed, which takes a couple of seconds to do and 30 seconds to give a result. If the test's approved by the regulators, it could be a game changer in the battle against coronavirus. It was developed by Professor Hosenheck at Technion. It's all about quick identification, which could make COVID testing more widespread. Another test which is being developed is what's called a gargle and split COVID test by Professor Schwartz at Chiba Hospital, which would be suitable for care homes and mass screening in airports. Results for that are ready in 30 seconds. It's fast, cheap and non-invasive. The regulators both have to look at those, of course, first. So that's all for now. Thank you for watching and see you soon, hopefully. Bye.